Hi, I'm Dr. Renee Azar. Today I'm going to go over preoperative instructions. We thought perhaps if we can email them to you, you can pick them up at the office. We'll be posting them on our website. I'll update you on that pretty soon. And also you have an option to listen to them. Some of us are visual learners, some of us are audio learners. So you can get a notepad out and take notes if you want to as you listen to my discussion of the preoperative instructions. I think this is helpful too because I think it's important for patients to know a little bit about what to expect and also to understand why we do these things. So one really important part of the bowel prep for surgery is following instructions on taking clear liquids for the day before surgery and taking Dulcolax at noon and 8 p.m. the day before surgery. We also like you to drink a Miralax cleanser where you put a bottle cap full and 8 ounces of a liquid of your choice, clear liquid of your choice. And then repeat it every 15 minutes until the Miralax is making your stools clear. And it should be consumed by that point or gone at that point. The reason we do that is that I have a need to be able to see what I'm doing. So the bowels, when they're full, are in my way. Makes surgery more complicated, makes surgery longer and more technically difficult. And technically difficult also can equal higher risk of complication. So having empty bowels is important for that. Also, having empty bowels is really important because during the time that I'm doing surgery, I'm working in the female genital area. That is an area that has bacteria. We clean it off really well, but if somebody has a full colon and stools coming out a little bit and it's not clear, there could be some bacteria in my surgical field, which is not good. So we like to have a nice clear liquid stool, and that tells us that that's going to keep your surgery safer. And your benefit is that people are oftentimes really concerned about getting constipated after surgery. I almost never see constipation after my surgeries. And the reason is because people have a really thorough bowel clean out. And so they don't even have a normal BM for 7 to 10 days after surgery, which is really helpful, particularly when I'm doing surgeries that involve the colosphincter area. Some other preoperative instructions which you need to know is that it's helpful to bring your medications to the hospital. Not that you will necessarily take them there, but there are a couple different situations. Sometimes we need to clarify dosages, and if your bottle's with you, we can do that more easily. Secondly, sometimes the hospital doesn't carry certain types of medication, and I may want to start a certain medication that you're on in the immediate post-operative time period. And if the hospital doesn't carry it, it might be a couple days before they can get it. And it's perhaps better for you to just be able to take your own medication at the hospital, and that will be documented and followed so we can make sure that you're taking appropriate doses, etc. But also you want to take any medication related to lung, heart, asthma, as usual on the morning of surgery. You do not want to take blood thinners for 2 to 5 days before surgery. We have a little flexibility in that because some people are at higher risk for problems off of their blood thinners. So in people who are complicated, we will usually have some kind of communication with the doctor that prescribes that blood thinner, and we will tell you how long we want you to be off that blood thinner. But in general, it's anywhere from 2 or 3 to 5 days. Do not take glucophage or metformin for 2 days before surgery. Other diabetic medications are okay to take before surgery. Do not take aspirin-related products. Now, you can take Tylenol because Tylenol does not have any blood thinning properties, but aspirin, goody powders, ibuprofen, naproxen, all of those type of medications, except for Tylenol, can put you at risk for increased bleeding during the time of surgery. And I think I don't have to tell people why that's a problem. Do not take some of the, actually I prefer for you to stop pretty much all herbal medications for about 2 weeks prior to surgery, because some of these herbal medications can also cause blood thinning and predispose you to getting problems with bleeding intraoperatively or postoperatively. St. John's wort, ginkgo, ginseng, etc. Just in general, it's probably good to stop herbal medicine for 2 weeks prior to surgery. That should not be a medical problem for you, and it will prevent us from having any medical problems afterward related to that. Do not eat or drink anything. So if you're doing your bowel prep and you feel like your bowel's not necessarily cleaned out, do not eat or drink anything after midnight. If you're not able to complete your bowel prep or you feel like it hasn't worked well, if it's early on in the day, you can call me. But just in general, it doesn't have to be immaculate, but it does need to be, we really like you to have clear stools. If you tend to be constipated, I would ask you to start this bowel prep thing perhaps earlier in the day instead of starting at noon, maybe start it at 8 a.m. So you know your body. And the bottom line is we want clear liquid stools by the time you are in for your surgery. But it's very, very important not to eat or drink anything after midnight the day before your surgery. Do not wear lotion or nail polish. We are trying to track your vital signs. The little stickers that we use to follow the heart rate can't stick to your body if you use a lot of lotion. Nail polish can interfere with our ability to read with a pulse oximetry on your finger your oxygen levels. So it's best if you have no lotion and no nail polish on. Please bring a CPAP machine if you have it. It's important to bring it so that you can use it after surgery. This is why. After surgery, you will not only be sleeping at the hospital, but you'll not only have the tendency to have whatever sleep apnea symptoms you normally have, you'll also have some pain medication on board. And that pain medication will potentially sedate you pretty heavily, and you need your CPAP to help you breathe and get the oxygen moving in. Otherwise, you may get some low oxygen levels, and then we have to figure out why that is and do extra testing, etc. And if it's somebody who has the respiratory effort being a little bit slowed down, and a CPAP machine can help you to move that oxygen a little better, that's a really important thing to have at hand, is your CPAP paraphernalia. If you're going to be late for surgery, we have a whole operating team prepared and waiting for your surgery. We have a whole operating room prepared. All the instruments are pulled. We can only do that within a certain time frame. There's a lot of wastage of money and teamwork and effort if somebody just doesn't show for surgery. Or if somebody's running late, we can potentially make things a little bit less costly for the system by, for example, if we knew that somebody was running late, we may not pull their surgical equipment quite so early, because if it sits out too long, then we have to put it back over again and restock the room. We can't set it out for too long. So there are a lot of little details that you may not be aware of that are going to affect how we approach the day if you're running a little bit late. So please call my emergency number and let me know. That's on my answering machine. It's about the third prompt. If you are a surgery patient or you have an urgent question or issue, please call Dr. Azar directly at 364-2945 or call the hospital as well is good too. And we also like people to know that it's really important to tell us if you have a history of blood clots in your lungs, blood clots in your legs, heart murmur that requires antibiotics before surgery or dental work. If you have joints that have a limited range of motion or tenderness, and sometimes we position people in the operating room while they're awake. A lot of times we put people to sleep and then position them in the surgical stirrups that I use. But if you have a joint or a problem that is potentially going to be worsened if you're positioned incorrectly, then we can position you while you're awake and then put you to sleep. But we need to know that that's an issue for you. If you've had hospitalization recently, please make sure we're aware of that. Sometimes there's a health condition that we need to know about that might change how we approach you, or might change the ability that we have to do surgery on you. Not only from my standpoint, but also from anesthesia. It's not only Rena Azar is willing to do your surgery, it's also anesthesia is willing to do your surgery. So they have some things that would make them want to cancel or delay your surgery. So we need to be aware of any recent or changes in your hospitalization or surgical history. When you come in, you will be registered at the front door, and you will come up. You will be allowed to have a family member with you. Usually, there's a little bit of variability in that. In other words, some days you can have 2 people, some days you can only have 1. It's a little bit based on the COVID status currently, as you can imagine. But generally, people can have somebody with them. If you have any pressing questions, please don't hesitate to tell the nurse so she can call me and tell me. On the day of surgery, I'm generally very focused and very busy, and I'm trying really hard to give my surgical patients my very best focus. So I try not to get too distracted with other things, caught up in conversations that might make me late or might distract me. Believe it or not, before each patient, I review special notes that I have in the chart so that I can make sure I'm aware of every little thing that might affect how I approach your surgery, both from an anatomy standpoint and also from a standpoint of perhaps pain medicine afterward. Are you somebody that has a lot of nausea and vomiting? Was there some scar tissue I was worried about? So I'm trying to really prepare for my next surgery between surgeries. And I'm glad to answer questions. When you come in to the hospital, if it's a pressing question, the nurse can contact me and ask me about that. Also, I will see you before surgery. I will always see you before surgery. And I kind of go over some things that I like you to be aware of during the surgery, after the surgery, etc. I'm going to touch on that in just a minute here. But you'll have an opportunity to see me, to ask questions, and we'll kind of go over some things that I really want you to know in the immediate post-operative period, again, at the bedside. So please know that I will always see you before surgery. The other things that I like people to be aware of is that there are just a few things that I want you to be thinking about post-operatively. You're tired, you're sore, just for a little bit, hopefully. And I want people, when they come out of the operating room and go to the floor, to know a couple things. One is that when you go to the floor first, your pain control will probably be the least effective at that point, because in recovery, we're trying to wake you up. And when we're trying to wake you up, we can't give you too many pain medications. So just know that as soon as you get to the floor nurses are excellent. They know that I really, really like good pain control to start with and just continuous. So they will jump on you and get your medications on board to get you comfortable. But don't be alarmed, and tell your loved ones, don't be alarmed if you're a little bit uncomfortable when you first come to the floor after surgery. You will have a scheduled pain medicine by mouth, and that pain medication by mouth will be given to you by the nurse without your even asking, at regular intervals. I like to have good pain control throughout your stay. We need to figure out what works for you. If what you're getting by mouth is not strong enough for you, I have an order for everybody to get some additional pain medicine through the IV. You can ask for that. The nurse knows that if you continue to ask for breakthrough medication through the IV, that we need to increase your dose that you're getting by mouth on a regular basis. So she will call me and we'll talk about what we can do to improve your pain control. That will be an ongoing process at the hospital. As soon as I know that we have good pain control for you, I will send your medications into the pharmacy electronically. That brings me to a very major point, and that is this. It is hard to get patients their pain medication once they leave the hospital. They're gone. I can't get it to you by writing it. I can't call it in. The pain medicines post-operatively, most of them have to be sent electronically. So be prepared to ask a family member to go get your pain medication before your discharge. That is absolutely the most ideal way to make sure that you have your pain medicine when you get home. Be aware of a couple things. Pharmacies will frequently say to you, your pain medicine's ready, but it's not approved by the insurance. Do not be scared of that, because it's not reasonable to start a pre-authorization process for pain medication, because realistically it's going to take a few days. You're post-op, you need it right away. All these pain medicines, every single one of these pain medicines is very, very inexpensive. It has a generic version. It's very inexpensive. You can go on GoodRx, or you can just tell the pharmacist, I want the generic version, and they will sell it to you for that. Sometimes the insurance companies say they won't pay for it all, or they will only pay for 7 days of it, when I usually prescribe about 10 days worth. Doesn't matter. Just get it with cash. Just tell them you'll buy it with cash. Sometimes there's a hitch in the electronic system, so perhaps it doesn't go through, or it doesn't go through to the right pharmacy. As soon as you know about that, please make sure that I'm aware so that we can troubleshoot that, because once I leave the hospital and you leave the hospital, it will be really hard for us to get your pain medicines to you. And that's why I really prefer to figure out quickly what medicine works for you and then send it into the pharmacy so somebody can pick it up, ideally the day before you go home. For all my patients, with the exception of a cold knife conization, and you'll know which patient you are if that's what you had done, all patients, with the exception of that, are waterproof. Waterproof. I love you taking a shower. I love you taking a bath or a sitz bath. It's really important if you have surgery down in the perineal, which is the genital area toward the outside. It's really important to put some soap and sudsy stuff down there. You're not going to break anything. And then rinse it off in the shower or the bathtub. The bathtub is really good, and you can get your abdominal incisions wet as well in the bathtub. And you can get soap in there, Epsom salts. Not a lot of either of those, but some of that in the water is good as well. And that heat to that area will help your immune system come to that area, and it will dramatically enhance the healing. It keeps things clean. It brings the immune system there to help your body to heal more quickly in that area. So I'm a huge advocate for tub baths if there's any way for you to do that. It's not that you can't go without, you can't survive or heal without a tub bath. It's just that it's going to be a lot better, healing a lot faster process. And it's actually very, very comfortable and relieving to sit in a hot bathtub. Diet when you go home will be regular, but I do tell people to avoid spicy and greasy because those are things that most tummies don't like after they've had general anesthesia. When you go home, you should have an idea about either a specific appointment time that you'll have, or you'll be told to call and make an appointment within a certain time frame. I definitely like to see all patients within 1 to 2 weeks of surgery, with the exception of a few very, very minor surgeries that I do where I will call the patient with test results. If you get home and you have nausea, vomiting, fever, chills, most people have a little bleeding down in the genital area, but if it becomes worse, I would like to hear about any of those symptoms, okay? And I actually tell people that I really prefer to hear about anything that's concerning to you for 2 reasons, because you may not know what's good or bad or what may be normal or what may not be normal, but I do, so run it by me. Also, sometimes people worry for like a week about a symptom, and they could have called me, and then with a 3-minute conversation, I can give them some relief and keep them from having a lot of anxiety about, what's going on post-operatively. So hopefully this video is helpful for everybody in terms of preparing for the surgery, preparing for the hospital stay, and for the immediate post-operative stay. Most of my patients will be seeing me on a really, really regular basis, with the exception of some maybe out-of-town patients where we might do televisits. And you'll have lots of opportunities to ask questions during the post-operative time period about how you're healing, about certain symptoms you may have, and also about activity restrictions. And those are a little bit variable because everybody heals at different rates. And in my interaction with you, I'm going to try to evaluate, are you somebody that's going to overdo it or underdo it, and make sure that we kind of include that in my idea about what's going to be reasonable for you to do at any given point in your post-operative healing course. So I hope you found this helpful. Don't hesitate to call if you have questions or problems, and have a great day. Look forward to seeing you.